Good evening, my dear friends. I have a lot of free time today, so thought about uh, talking to you after quite a long time. So one of my patients asked me last time that in case she has high uric acid, should the medicine be continued lifelong, or how can we know that about it? So in the Indian population, we commonly find that uh, the uric acid produced in our body by the destruction of cells and the regeneration of other cells uh, does not get excreted or gets less excreted, so the levels rise, rather than in the Western population where they take more meat and cheese and alcohol, which is why, due to dietary intake, uh, uric acid rises. So, in cases where there is increased dietary intake, you can reduce the dietary intake of high proteins, modify your diet, and then recheck the uric acid levels and gradually reduce the drug dose. In the Indian population, generally we find that we may reduce the drug dose, but usually the drug cannot be withdrawn. I would like to talk about obesity today because in many of my patients, I find that many of you have a BMI of more than 30. So a BMI of more than 30 means, or we grade the patient as obese. BMI less than 25 is known as normal. Anything more than 25, 25 up to 29.99, less than 30, is overweight. Now we find that those patients who are obese are not only at risk for developing more cases of type 2 diabetes, hypertension, dyslipidemia, or increased blood uric acid, blood cholesterol. Apart from these, we also find that these patients are more susceptible to severe respiratory infections, as was COVID or like other pneumonias. So, keeping your weight in control, keeping the BMI less than 25, if possible, at least within a reasonable range of, say, less than 27, should be done, should be tried as far as practicable. Recent outbreak in China of the human metapneumovirus, or the HMPV virus, has happened in northern China. So it is also a virus like the corona. It attacks, it's a respiratory pathogen, attacks the respiratory tract in the season changes, and usually infects small children, maximally less than 5, and the elderly as well. It's almost similar to a respiratory virus called RSV, or respiratory syncytial virus, which is a very common respiratory pathogen for children. HMPV usually does not cause mortality, but it can cause, in cases of children less than 5, the elderly patient, immunocompromised patients, just similar to the COVID pandemic that you saw. So try to keep your body weight under control. Try to keep the vitamin D levels high, around 50 international unit per milliliter. And please complete your vaccinations, the influenza and the pneumonia vaccinations. Try not to gather in public places having large crowds. Try to again use proper masks, preferably N95 masks. Start hand washing again, and using precautions especially for the elderly, immunocompromised, and especially for children, because we don't know whether it will come to our country or not, but it is more likely that children will be much more affected. And though it has got low mortality rate, the infectivity rate is extremely high, and if in case it comes, we can again see a large outbreak. So it's better to be safe. Complete your vaccinations if you have not done them, not taken them. Try to maintain a good vitamin D level. Try to maintain hygiene. Regularly do your morning walk, yoga, give your body some sunlight, some time in sunlight. Try to reduce your weight to an acceptable BMI, ideally less than 25, if not then 27, 28, at least less than 30. And keep your other diseases like diabetes, asthma, or COPD, or other diseases under proper control. And another thing that I have noted is people nowadays almost depend daily on junk food. So that is a very poor habit. That should be stopped as much as possible. And try to keep your children healthy as well, and try to keep your children away from junk food as well, and encourage them for physical activity rather than engage them with a mobile phone. So thank you, and we will meet again.